Well, to discuss this matter a little further, we're now joined by the chair of the field of Social Security Systems Administration and Management Studies at the Wits School of Governance, Professor Van den Heever. Thank you very much indeed for joining us, and welcome to the program.
Thank you.
You know, in one of my earlier careers, I spent years as an auditor, and one of the things that we used to do first was check the systems, even before we looked for any things that were going wrong. Is this a system failure more than, because we're focusing at the moment on what has happened, but I wonder if there isn't a bigger problem that we should be focusing on, and that's the systems themselves.
I think we are looking at a systems problem, and it involves the relationship that exists between political office bearers and the political party and members of the administration. Because if you look at this case, this is not unusual. When you look at the levels of irregular expenditure at the provincial level, at local government level, there's a systemic pattern here. And it means, what it implies is that there are people who feel that they are essentially protected in entering into corrupt arrangements. And this comes from being able to effectively appoint everybody to every part of the system so that there are no checks and balances that can operate. And what you're seeing here is effectively two director generals. The first is the deputy director general who was acting at the time when this contract came through, as well as the subsequent appointed director general being implicated. Now, for so many senior officials to be implicated and effectively following the orders of a minister shows you just how it operates in government, and that suggests it is more than trivial misconduct. It's essentially systemic.
So how did it get to that point, I guess, because every year the Auditor General comes in there, doesn't he, and fields reports, and these things would be seen.
Well, they're not always seen. I think that they actually, if you look at the SIU report, there was an attempt to disguise the nature of the contract and the relationships. And so there was clearly a feeling among some people that they could get away with this, and that it would avoid the eyes of an external auditor, because they would not actually see that there's a relationship between this company and, for instance, the minister or any public official. But they were operating a front, basically. But the fact of the matter is that people felt sufficiently confident on the one hand, the actual tender itself and the way in which the documentation was managed may have escaped the eyes of the Auditor General, unless a query was raised by somebody who lost the tender or a whistleblower. So I think that we probably wouldn't even know about this matter if it wasn't that some whistleblower actually blew the whole issue open. And then there was an intrusive investigation which then reveals this information. So yeah, it might have escaped the Auditor General, but it won't escape an intrusive investigation. And what I think these guys were hoping was that there would not be any such investigation.
In the scheme of things, yes, 150 million rand's a lot, but it actually isn't when we look at the budgets that these departments have. My fear then is this was picked out, but what else could have been happening?
Well, first of all, there is quite a serious issue here. These are the guys, this is the team that was proposing national health insurance.
Wow. And
the national health insurance arrangement involved this minister being able to appoint everything in the kitchen sink into a national health insurance fund. And Anban Pillay, I've debated him on television in relation to specifically raising the risks associated with the corporate governance design of the NHI. And he sat there in an interview with me saying there will be no corruption. And Dr. Nicholas Crisp, who's the current acting Director General, who has not acted against Anban Pillay to date, has also been saying the same things. So this is very worrying, because what we are looking at in the case of the NHI proposals is not the procurement of 150 million, but the procurement of 300 billion rands worth of health coverage. And basically they're setting up a centralized purchaser. That's a procurement system in which essentially a minister is in a position to set up everybody around that whole procurement process and ensure that nobody ever gets to know what's going on. So this is the risk at that level. But what we have seen in the rest of the health system and the rest of the public sector is that when you take a look at the levels of irregular expenditure, those are all instances where people have not followed tender processes properly. And there's only one reason for doing that. It's not a mistake. It's not a clerical error. They've done it because they're actually gerrymandering the tender to go to specific people and groups. And very little action is taken after the Auditor General has actually raised the issues. There's no follow-up in most of these departments. So this has been systemic. This is a practice that has emerged from the provincial level up, and this minister was a MEC for Health in KwaZulu-Natal, MEC for Finance, and the Premier. So he's been through this entire system. And this is what people have got used to in the system, and it really tells you what's been going on.
At the end of each Auditor General's report, we do these interviews, and the defense is always irregular expenditure isn't always fraudulent expenditure. And I suppose when you start euphemizing things, that's when we start the train starts coming off the rails.
There is no reason for not following an appropriate tender process other than to gerrymander the tender. So the fact that there are irregularities in the process, and if you look at this is a pretty gross example where the tender process was manipulated, the scoring was manipulated to eliminate a potential competitor. Now you think that's happening systematically. So the question is, why does the Western Cape, for instance, have such low levels? I mean, incredibly low levels of irregular expenditure. It essentially means the Western Cape Department of Health, for instance, is not actually behaving irregularly. I mean, they're not acting in a corrupt manner. But when you start to look at the levels for every other 8 province, they are at such high levels that it can't be a clerical error. It is systematic. The irregular expenditure is being condoned effectively throughout the system, and it's all around the tenders.
And I suppose, as you've raised that example of the Western Cape, the systems are not what the problem is the custodians of the systems.
It's what I'd call top-down corruption. It's essentially capture from above. So a lot of systems are actually designed, the kind of systems you refer to, are there to kind of capture the bottom-up corruption, the individuals and the misconduct of individuals within the system. And theoretically, the systems that are set up should have checks and balances so that there's a kind of a separation of powers that would exist within the organization so that there can be a check on what people do. But the top-down corruption is able to essentially break through those checks and balances because they're right at the top of the system. So what you essentially are in a position to do is, as we've had with the Zondo Commission, you're able to capture an entire procurement process end to end. And if you're in that position, you can then manipulate the procurement processes for patronage purposes. And that's really what we've seen, that it's become systemic at that level. So it's not something about an individual, it's not a rotten apple here and there. It's essentially a system in which only rotten apples get to the top of the system and they control it.
You know, we hear about King on governance and how such great literature has been written. We talk about ethics and leadership. And I'm just wondering what's happened that we are in a situation like this. Is there a lack of understanding of what good governance is? Is there a lack of understanding about what ethics are? Are we having leaders that don't even bother reading literature like King on governance?
So King refers to a corporate governance structure and design where you're dealing with what is essentially a principal-agent problem where people are looking after other people's money. And that is a fundamental issue in the state, is that they're looking after other people's money. And what we actually have are very, very crude corporate governance structures and accountability designs that are easy to crash through. And these holes and gaps in the system of South Africa's government were established after 1994. I heard Stephen Friedman's comments on it in an earlier interview. It's not just that they were happening since 1652. These were set up. These arrangements have allowed for political office bearers to influence the appointment of staff within the administration. And around the world, one of the first things you do is you break that relationship. And then in our state-owned enterprises, the corporate governance designs have still allowed for ministers to interfere in the appointment processes of those organizations. And once you allow that, then they have an incredible concentration of power around both the political office bearer and the gap that then gets created via the political party to that political office bearer. So that becomes the way in to this huge pot of money in the state. And essentially we have to close that. Now we have gaps everywhere. Every single institution is essentially exposed to this risk, because wherever we have a situation where a minister appoints, a minister removes, we've got a problem, because that organisation and institution is then subject to their influence and interference. And in the cases of organisations like SASA, for instance, a minister is in a position to even overrule procurement processes. A minister. These are designed into the legislation. So we've got big state institutions that have enormous gaps in them, and essentially there needs to be a fundamental review of every single organisation we have in the state, including the general administration, that allows for people to for us to create permanent administrators in the public system that are completely separated from the influence of the minister. And so they are there to carry out the functions of the executive of government, but they are not there to follow instruction on procurement or on appointments.
Professor van den Heever, we're going to have to leave it there, but thank you very, very much indeed for your insights on this case and what it means generally across the board. Thank you so much for your time.
Thank you.